Hi, welcome to Body Beautiful. I'm Janelle Marie. This is the show where we talk with local professionals about the latest in medical devices and procedures. Any advice we give you today, remember, consult your own physician first. We are in the Walnut Creek office of our good friend, plastic surgeon, Dr. Joseph Mealy, talking about all kinds of things plastic surgery. We've got, breast augmentation revision, liposuction, Brazilian butt lift. We're going to see if that's still popular. And what is brachioplasty? We're also going to answer that question. Hi, doctor.
Hello, Janelle.
So glad to have you once again. We always have so much fun.
Always.
Let's get right into it because we have a lot of before and after pictures to show you. And let's talk about breast augmentation revision now. First of all, who's a good candidate for that?
So breast augmentation revision is done for several reasons. Usually it's to maintain the result that we've gotten with breast augmentation. Sometimes it's just to go a little bit larger and there's really no physical problem. Other times it's because the capsule around the implant has become hard or moved the implant. And in those cases, it's less optional. We really do want to make it look better and feel better.
So these are people with that had surgery before and probably didn't go so well. And they're coming in to you to say, hey, can you help me fix this?
Well, they're coming in to help fix things, but sometimes it went just fine. And there's been a pregnancy in the middle, or the capsule has developed over the years to the point where now we need to fix it. But there are some times when it just doesn't go well the first time, but hopefully their surgeon will help them with that. I know that's what I would do.
And if they don't, they're going to come into you, and that's why we have these pictures. The first picture, wow, this is an amazing before and after. So what's going on here, Dr. Mealy?
So I see things like this when there's either been very severe capsular contracture. So the capsule is the normal scar that forms around the implant. It's very important because without that capsule, the implant would just move around under the skin. So it does keep it in the breast where we want it. But if it gets too tight, sometimes it'll elevate the implant. And then it looks like the breast has fallen off. And then we call that a waterfall deformity. The same thing can happen. In this case, the implant is high. But in cases where the implant's in the right position, the same thing can happen with pregnancy where the implant falls lower. So in this case, I want to both lift the breast to get rid of that loose skin and lower the implant to get it to match the other side, because you can see the other breast on the other side. It's kind of in a much better position.
Oh, I see. Yes, exactly.
We like them to match.
Oh, I gotcha. The after is amazing. I mean, so natural. It doesn't look like you did anything. How did you perform that? Where are the scars on this?
So this is a combination of revising the pockets. We've done a capsulotomy, revised where the implant sits on the breast, on the chest wall. And then I've done a lift. In this case, it was an inverted T lift. It's sort of that anchor-shaped scar.
Gotcha.
That allows me to remove extra skin, elevate the breast tissue, but still leave the nipple areola attached so that hopefully sensation and circulation are well preserved.
Totally worth it. It's a beautiful job. Let's go to the next picture. What's going on here?
Sure. So this case, we've got similar problems, but in a different position. In her case, she'd had a lift before, but her right breast is still a little bit lower. And you can see below the blockout square that the incision is kind of red, and it just healed very red for her. So what I've done is revise those scars, actually redid the lift. I think we changed the size of the implant a little bit, went down a little bit, which also helps when we're having trouble healing or the implants are pushing down farther. And then in the process of the healing, we've done silicone, we've done topical care. Sometimes I'll even use a little laser if we need to get the redness out. And you can see on this picture, the scar is still in that same position, but it's much lighter and very hard to see.
Looks so much better. Let's go to the next picture while I ask you, what's recovery? Is that just normal, like just a normal breast aug, or does that take longer since you've revised it?
It can be. Usually it's a little bit less, unless a lot of work needs to be done on the capsule. Then we've got a similar kind of recovery as an initial breast augmentation.
And the next picture?
So this one, we've got a breast that's in a normal position, but the implant's bottomed out.
Yeah, I can see that.
You can see sort of that, we call it a double bubble.
Big time.
So the lower fold is where the implant is, and then the fold above it is the normal breast tissue sitting above the implant. So in these cases, it's very important to reestablish that normal fold that we can see and put that back to the chest wall, close off the pocket so the implant stays higher.
Gotcha, so it doesn't slip down anymore.
Exactly, and in some of these cases we use sort of an absorbable mesh to hold them in place so that it heals higher and has less chance of dropping back down.
Let's go to the next picture.
Sure. So here's someone who had just sort of more mild waterfall deformity. The breast has dropped off the implant. And in her case, we've elevated the implant. I think in this case, we changed the implant. Sometimes we want to change size, either bigger or smaller. And again, done a lift to get the breast tissue back up and redrape it around the implant.
I love the before and after here because, again, that's natural, and I mean, it looks great. And our last picture.
Sure, and the last one, a little more subtle. So she has a capsular contracture on her right side, on the left side of the picture. And you can see that implant is higher, and it's been moved outwards a little bit and kind of lost, or actually elevated the inframammary fold on that side, too.
Did you change the size of the implants in this one?
In this case, I did. Often, though, when we're doing work on the capsule, when we have severe capsular contracture, we go ahead and change the implant to make sure that there's not something about the implant or some contamination on the implant that's causing the capsule to get inflamed, get thicker, or elevated.
And just a real quick question, we have about 40 seconds left.
Sure.
How do you know where to put the implants, under or over the muscle? I mean, is that just normal if somebody comes in, you know, or do you, how
Sure.
does that work?
There are advantages to each. I think with the majority of cases, we're going below the muscle. It gives a little more support, helps the implant heal better, decreases capsular contracture and other risks. But there are specific reasons why we go in front, and I talk about that with each person.
Gotcha. So it's very individual for sure.
Yes.
All right. Well, these are fantastic before and afters. If you want to see the more before and afters or all of them, you can go to the websites. I'll give you that in a minute. But if you want more information on any of these procedures, give the doctor a call at 925-943-6353 or go to his websites, drmealy.com, or you can go to sanfranciscobreast.com, and that's San Francisco spelled out. We'll be right back talking about liposuction.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.